Hi, my name is Bipasha, and I'm a medical student working with Wisconsin Voices for Recovery to bring you Saturday Night Chats. Saturday Night Chat is a monthly chat that creates a space for people to share their recovery journey and to show people in and seeking recovery that they are not alone and that recovery is possible. Today, we'll be hearing from Emma. Hi, Emma. Thank you for joining us.
Hi.
Tell me about why you wanted to do this interview.
So originally the format was brought to me by my supervisor. She's a very large advocate in the recovery community. And I do peer support for Wisconsin Community Services, which allows people with lived experience with mental health and substance abuse to help others alike either find resources they need, um, and or help them along with their journey towards sobriety or mental health services. It's just more so meeting the individual where they're at. When this particular opportunity was brought to my attention, it was more so talked to about to me in the form of like stigma. And I did an interview prior to this with Voices for Recovery on, I think it was called Stigma Stompers or something along those lines. And this was somewhat of a follow-up to that.
Yeah, they also have another interview series called Speak Out on Stigma, so maybe that's what the one that you did, which is a shorter interview series. But that's great
Cool.
to hear about your involvement with Wisconsin Voices so far. Tell me about your recovery story.
So I guess my recovery story, um, active addiction started for me probably at like the age of 13, and it was more so of like experimentation with marijuana and alcohol, all through high school up until about the age of 18 when I got introduced to opiates. And then I would struggle with that until I was 24, um, when I would end up ultimately finding long-term sobriety. But um, I I tried really all avenues of recovery along my journey. Like in 2008, there wasn't a whole lot in the Waukesha County area as far as resources exist. There was a place called the Lawrence Center, and that was really the only place in Waukesha County that existed besides one methadone clinic. So I did go there for my first detox ever, and it was a very confusing experience because there was not a whole lot of education involved in it. I sat in a room for about 6 days and then I was released, and I was using in a matter of 12 hours again. So um, that cycle kind of would continue over the next 4 or 5 years, where I'd go in and out of Rogers for detox and multiple Suboxone programs. Back then, there was still a lot of cash Suboxone doctors. Um, Insurance was still really hard to get it covered. It was very rare that you would get insurance coverage for Suboxone at that time unless you had like straight Title 19 through the state of Wisconsin. So a lot of those struggles existed early on in my recovery. Um, in 2012, I um, got on methadone, which actually was like my last hope at recovery. I was very much against it for a very long time. And it was like my last ditch effort at life. And I remember going in there and telling them that, like, I don't know what else to do. I'm going to die if I don't find something that works for me. And through medication assisted treatment and extensive therapy, one-on-one through a private setting and then through the methadone clinic, I was able to obtain long-term sobriety and have really built my life from there.
Thank you so much for sharing all of that. It's really quite a long journey that you've been through and a long sustained recovery at this point, which is amazing to hear. Thank you for sharing that.
Thank you.
Um, can you tell me more about what has been helpful to you in your recovery?
Well, I think obviously through each one of those experiences, I picked up a little bit of something. But really getting to like the root problem of, the traumas that existed in my life and taking, the fundamentals of, building up a support system and um with that support system, I mean, my family relationships, my friends, having a sober community, um pro-social activities. I mean, you have to have things that you enjoy doing in recovery and lots of self-care. Like I said, many of us who fall into addiction, whether it's substances or not, have some deep ingrained trauma of some sort. And that self-care I find very crucial. To sustain my long-term sobriety. It's really having to feel good about yourself and the life that you've created.
Absolutely. I'm glad that it sounds like you've been able to build a lot of skills to maintain this life that you've built for yourself, which is amazing. Um, on the other side, tell me about what's been hurtful to you in your recovery or the things that sort of held you back in that per time period, kind of between 2008 to 2012.
Um, I mean, in active addiction, oftentimes like I accrued a lot of debt, financial debt, whether that be through most of it was through the legal system, with tickets and like the last part of my active addiction, I had accumulated 12 charges in the matter of like a 6 week relapse. So, it took years to rebuild from that. But in doing so, like it kind of comes full circle to like the stigmas of, in my recovery, I noticed like when looking for an apartment, they run that criminal background check and you don't want to rent to a felon or somebody that has a drug charge. And like seeking gainful employment, that's going to be a career and not just a job. Everything really revolves around that criminal background that, I had acquired during active addiction. And um, I had even gotten a job at uh, a local university, I'll just say that. And they had hired me and um like 2 weeks after being employed there, the background check had came back and because they had been trying to get me to work there for a long time. And once I did, they didn't even do the background check right away, but when it came back, I remember my supervisor coming in and she just looked so defeated and I was like, what's wrong? And she let me go because of the criminal background check. And that was a really big setback. Like I remember wanting to specifically use that day because I was so new in my recovery journey and I was devastated because it was one of the first steps towards not just bartending or serving anymore as a job, but actually trying to build a career and being walked out of a professional setting was pretty humiliating. I was devastated in that moment, but then also like going into the emergency room and having like simple things like a toothache and them not wanting to treat the pain because of a point in my addiction. Like red flagged myself as an addict so I wouldn't be prescribed opiates. Like that's how hard I was trying to stay sober, was preventing myself from being prescribed pain meds. But, fast forward 10 years later and I'm, stabilized and wanting to um, get something to treat a massive toothache, and they wouldn't. So there's been a lot of things along the way that I found to be a heavy reminder of my past and what I had done for that 10 years of my life in active addiction.
Yeah, that really is so hard that things like criminal records or medical records are so right now so permanent and that they can affect you no matter how far into recovery you are. And that's definitely something that we as a society should work towards changing the way we think about that and the way that it can affect people 10, 20 years down the line and the decisions that were made in the past, no matter how much work they put in to get to where they are today. Thank you for
Absolutely.
sharing that.
Of course.
Um, in our past conversations, we had talked a lot about your struggles with the healthcare system, and you touched on that a bit with your emergency department um, experiences. Is there anything else you wanted to add about how navigating the healthcare system was for you as a person, either in active addiction or how it is now for you?
Yeah, I just I think things can be so black and white regarding uh people's treatment, and it intertwines with health insurance companies and healthcare organizations as a unit, because I have been on private insurance and state insurance, and I've found road barriers on each. And um I think it's really unfortunate in 2025 we are still basing people's healthcare on um like the status of their insurance, or what they are allowed to have based on what plan they're in, and not just like basic needs. And I feel personally, and it's my opinion, that healthcare should be a right to those that are in need of it. And there were times where I would be facing like a 6-month waiting list for a psych eval. And, my ex had severe depression, and so did my father. And if they would stop taking their antidepressants and needed to get back in to see their psychiatrist again, some like one point during 2020 they were booking out over a year, just because of the pandemic. And I understand that that was a rough time in society, but when you're talking about people that need life-saving drugs, like who are on the verge of suicidal ideations, there should be no 6-month waiting list. So maybe like just doing better in terms of making a priority to those who really need things, like um with psych meds and substance use disorder. It Some of these things are life or death for a lot of people. And I don't have all the answers, but there are just a lot of flaws in the system. Even like when I would go into emergency rooms, and I know that they're doing with like the best with what they have, like those individuals are doing as they're taught. But when I would go in saying I was suicidal and I was addicted to heroin and using cocaine and smoking marijuana and drinking. And if I didn't have like a physical plan to kill myself, I have been sent on my way. Like, I'm telling you, I want to die. I'm telling you, I am thinking about killing myself. And just because I don't have a gun at home, they didn't admit me that day. And that is still very vividly clear in my memory how frustrated I felt that day wanting help. And um, I don't know if I didn't have the right insurance at that time or if they just didn't feel like doing it. But coming in and doing like a 5-minute biopsychosocial in the ED, and then me not fitting the criteria but wanting help and being sent on my way was a defeating feeling. And I just, I feel sad for people that didn't have the same support system or maybe home to go back to as I did, because I'm sure that there's many different trajectories of that same situation. Um, yeah, I mean, if you look at suicidal rates, I'm sure like there are people that have experienced those same situations and didn't see the same hope or have the same hope after, leaving there because their family or friends weren't like, we'll get you help somewhere sometime. So it's just more so like the little things that we could change that would go a long way.
Yeah. Yeah, and definitely an access issue with lack of providers or availability. And definitely could do a lot of work for better urgent and emergent mental health crises for people who can't seem to get the care that they need.
Yeah. Well, and then like insurance companies too, something like at a I mean, it goes so far high as like the government levels enforcing uh basic human rights and not just like financial gains off of, because insurance companies are a business and there's money involved in it too. And I mean, it goes so deep and it's so entwined in many different avenues, like nonprofit, profit, hospitals, outpatient, inpatient, partial hospitalization. Like there's so many different levels and tiers to services and components that go into it. But as a system as a whole, like we need to do better.
Yeah, definitely. Lot of layers to attack, and hopefully we can help start peeling back those layers with all of this information. You've talked a lot about like these not symptoms, sorry, these systems kind of being broken and not working very well. In your opinion, what would you say is the most important thing that a private or public organization could fund to help those in recovery?
It's that's a good question. I I talk about it with, because two of my friends, like really closest friends, also work in the field helping people in human services and, substance use and mental health. Um, I think there's like two components of it that I would personally say would be crucial, and that would be a housing crisis. I mean, there's so many people that struggle with mental health and substance use disorder on the streets. They're homeless, or staying wherever they can find to stay, whether that's a shelter or a friend's house or sleeping in their car. So there's a housing crisis component. So more sober livings, because it would tie into that piece of then like um detox and residential treatments that don't require like health insurance, because when there's homelessness and active addiction, you're not really thinking about, do I have health insurance? So then there's one place, because I live, like I said, in the Milwaukee area. There's only one facility that will take people that are uninsured or on state insurance for residential detox. And as you can imagine, there's always a waiting list. And like I had mentioned before, if someone is suicidal and wants help, addiction is very ambivalent in, okay, I'll go today and not go tomorrow. So when someone is ready, willing to change, I think we have to have the opportunity to take the person when they are willing and ready to go. And if anyone would enact those things that I said, it would be first having places that accept, like, there has to be some sort of government grants that could go into this. I know that the counties get opioid funding for things to help with, the opioid crisis, but um, some of those grants could be used to do what I'm talking about and offer this housing while people stabilize and, detox and residential for people that are or underinsured.
That definitely sounds like a great step that we could take in the right direction for supporting people because you can't do much to help yourself if you're if or that is like a big step towards helping yourself is being able to have secure housing. So thank you so much for sharing everything that you've shared with us so far. I know you talked a bit in the beginning, but just to wrap us up, can you tell me about what you're doing now in the space of helping others with substance use disorders as a peer support person?
Yeah, so early, I think it was sober like 2 years when I really knew that I wanted to give back and help other people like myself. One of the people I credit most for my sobriety, I mean, besides my parents and my higher power, is one of my therapists, and she was also in recovery. Oh, I was so hard to deal with, but she never gave up on me. And I just knew that I wanted to be that for somebody. Because when I tell you I was hard to deal with, like I used to come into her therapy office and I would just be still high on drugs and nodding out, and she would never turn me away. And I remember once I finally did obtain sobriety long term, I used to ask her, like, why did you continue to deal with me? Like I was so distraught and just a walking disaster. And she said, because you had the desire to change, like you were showing up for therapy. And oh, I don't want to cry, but she was like, if I turned you away, you probably wouldn't have came back, and you were trying to show up for yourself the best you could at that time. And um the fact that she didn't give up, like I wanted to be that for somebody else. And so I went to college and got my degree in human services, and I do have my SACIT to be a substance abuse counselor. And I did my internship during COVID, and it was really great and interesting, and I helped a lot of people. But then for my own mental health, I took a step back from it for about a year. And now I am currently doing peer support. I wanted to try a different avenue to see if it was more my style, and it's very similar to what I was doing as a substance abuse counselor, but you basically just remove the state barriers and the ethical boundaries put in place by the state of Wisconsin. And not saying they're wrong, but I just want to be able to connect people to people the most realist way that I can. And I'm still helping. As peer support, you are basically a sober friend with resources and meeting people where they're at. And I still navigate people to help people navigate to resources. And if they need housing, we find them housing. If they need food, we go to food pantries or get them applied for food stamps. Or and I also work with people long term. So I've seen people that I started with a year ago now. I just helped a girl buy a brand new car because she has long-term sobriety, and that's the first brand new car she's ever owned in her life. And it's just, it feels really good to see people come full circle like myself and still hope that life after addiction is possible. So that is why I do what I do and still try to give back to people like I was given, hope when there wasn't any.
Thank you so much for sharing your story. It's been really powerful to hear from you and to hear about these supports in your life. And I'm so glad to hear that you're now giving back too. That's very noble of you. And I hope it's also supporting your recovery too, to be able to help others. So thanks so much for sharing your story and for joining us today.
Thank you.